the great thing now is that the EU and the FDA have just determined that for a drug to come to market and to get approved, that it can't just be tested in adults anymore. So as child neurologists, we're just so used to using drugs that have been approved for adults, and then a lot of times insurance companies have a hard time approving it because it's only been approved in adults, and so we get stuck with not having as many options unless we could find an insurance company willing to work with us. So Vibrance came about because of this need to do a study in children and adolescents. And so, looking in safety and efficacy of nipocalimab in this special patient population for sure, while the ongoing adult study is taking place. And it's been basically done in two parts. So the first part has been for the older kids, the 12 to 16-year-olds, and now we're moving down to as young as 8-year-olds. So it's really going to be amazing to have these drugs tested in this population and also confirm that the dosing that we're using that's been determined is the proper dose for this patient population. Again, we always use adult-based dosing, and we're not sure if it's the right one for pediatrics or not.
This study featured patients who were seropositive, but is that also a complication, with patients with adolescents in general? Is it tough to tell when some of the changes are starting to be seen? Is it hard to also pick patients out? Obviously, if they're maybe in transition, I don't know exactly how that transition works, if they do become seropositive over time or if that happens earlier on per se. So is there any complications with that, I guess?
So we've had patients as young as like 6 months who have been antibody positive. And then we have patients who are teenagers who clearly have a neuromuscular junction disorder, what we call pretty much call myasthenia for the most part, in our patient population, who maybe don't have necessarily antibody positive, but their EMG may suggest that they have a neuromuscular junction problem. We trial them on Mestinon or do a tensilon test and see a benefit. And so we believe that they have a seronegative neuromuscular junction or myasthenia gravis. And so it is hard, I think, also, especially in adolescents. So, a lot of kids will come in with droopy eyes. And the big story is that they've been getting in trouble because people think they're doing drugs all the time. Or the parents will say, they're just tired all the time. And then they're like, well, and you ask them to smile and they can't really give you a smile. And they're like, yeah, like if you look at the pictures, like they just stopped smiling in the pictures. We just thought they were unhappy, right? So there's always this other backstory that we always give more to it, I think, adolescents. And a lot of these adolescents are labeled as functional or that they don't have an underlying organic reason to have these symptoms. And so a lot of them take a long time to get to diagnosis. And so I think that's where it becomes really difficult in kind of deciding how best to take care of them when if they're antibody negative, like how much do you push to kind of treat them as if they did have an autoimmune disorder?